this seems like a sort of rapidly growing field right now, and at least in my business, we've got a lot of clients who are in the vascular imaging business, and as exclusively, they're not making hardware per se, right? They're not making the CT scan or the MRI machine, but they are developing the software in order to use that as the mechanism of data extraction. What is going to differentiate yours from some of the other players out there that are in the market right now? And how do you build that fence, or can you accelerate this has been in development for 5, 10 years. So how do you build a moat around this if I'm an investor? Or how do you convince me as a Siemens or a Philips to be like, that platform needs to be on our big iron?
Sure. So the space of software as a medical device is growing rapidly, and we've seen with the change in chest pain guidelines that the rate of CT angiography usage will continue to accelerate rapidly. What our differentiation stems from is initially the approach that we've taken, which is that ground truth in histopathology, that we have a significant patent portfolio, significant know-how, and significant time and expense to build the database and perform the studies to do that validation. From there, we have a true understanding that the disease itself is the disease of the wall. We're not looking at the lumen to understand the effect of the disease, we're looking at the underlying cause. And by being able to understand that, we're able to then derive these additional models, measuring fractional flow reserve, understanding risk of event, and moving into true precision medicine. So our differentiation stems from an approach that took many years of hard work to get to where we are today. But that hard work pays off in the sensitivity and specificity and the measurements we're able to provide. They give physicians more information about how to treat a patient's disease individually to them.
I'd like to build on Blake's answer and with a little anecdote, and I'll leave off the names of the companies that were mentioned, but just to sort of tell the story. So I was giving a pitch, and there's the thought that larger computational-based companies, very large companies in the modern era, might be able to do this, because what they can do is they can use computational modeling, and they have clear skills. So if you provided them the data, they could come out with these insights. But this investor shared with me, he thought that there was a key part in the pipeline of the development of ideas that those companies could never do. The only way to achieve what we have achieved is the combination of a deep understanding specifically of the clinical and biological science of this disease area. Yes, coupled and enabled by computational sciences, but that the one does not replace the other. And I think this is what Blake is alluding to when he was describing those assets that Elucid has worked very hard to develop and which would be very difficult to reproduce. And those involve understanding the disease mechanism, collecting the tissue specimens, which is well known to be a very complicated and expensive process. Obviously, the application for patents to protect that position, but as well, just the approach itself of understanding disease, and with that, good selection of appropriate computational techniques in order to exploit that. Many companies, very large companies, have resources, but just because you have resources does not mean that you have combined those resources in a way that can do this.